Good evening. It's Wednesday, December 18th. Thanks for joining us tonight. I'm Maya Trabulsi. House Republicans and Democrats go head-to-head, spending hours on the floor debating the articles of impeachment against President Trump. Next, the historic vote. Karen Kafa explains what has transpired so far.
Today, we are here to defend democracy for the people.
Nearly 3 months after launching an impeachment inquiry, members of the House of Representatives are on the floor arguing both for and against a vote to impeach President Trump.
You see, it's also not a matter of process, which will be discussed today. It's a matter of actual facts. I will fight the facts all day long. Because what we found here today is a president who did not do as being charged.
President Trump faces 2 articles of impeachment, one alleging abuse of power by the president, another obstruction of Congress. The votes expected later today are likely to fall along party lines, with President Trump becoming just the 3rd president ever to be impeached by the House. Democrats arguing they are defending the Constitution.
President Trump's behavior is exactly what our founders feared most. They knew that with the awesome power of the presidency came the risk of a president abusing that power for personal gain.
And Republicans asserting there is no evidence of wrongdoing.
I rise in opposition to impeaching the president. Unlike the Nixon and Clinton cases, there are no allegations that the president has committed a crime.
President Trump said when the House votes, he won't be watching.
This has been a total sham from the beginning.
The president has a rally in Battle Creek, Michigan tonight. On Capitol Hill, I'm Karen Kafa.
The Navy is working through the mold problems in Murphy Canyon housing after several military families complained. KPBS military reporter Steve Walsh says the defense bill will give commanders more tools to deal with private contractors.
Hope Gwynn Bradley lives in military housing in San Diego. Her husband is in the Navy. In the past year, she's become an unofficial spokeswoman for other residents living in privately run military housing, including people who live in Murphy Canyon.
For some of these families, this is the first time that they've lived away from home. This is the first time that they have rented a home and been responsible for the things that happen within that home, and they just simply don't have the knowledge.
The problems with the contractors who provide private military housing for each of the service branches made nationwide news over a year ago. At Murphy Canyon, the problem is mold.
That's the thing. We're not asking for anything outlandish. We just want homes that don't make our children sick.
Tenants complained about mold collecting in their ductwork. Lincoln Military Housing, which runs the subdivision, sent a contractor who taped blue plastic over their vents. Bradley says the family hasn't been told when the contractor will be back. Other families have been kept out of their homes for weeks. She says the Navy needs to do a better job of managing the private contractor.
I feel like enough of us are saying, hey guys, this is not okay. Hey guys, they're not doing what they're supposed to be doing for our families. Hey guys, we need some help from somebody that can make some things happen.
The Navy, like all of the service branches, vowed to get more involved after widespread complaints of substandard conditions. But in San Diego alone, the Navy found they had little leverage to force changes under the contract with Lincoln Military Housing.
Well, right now, again, it's advocacy. If there's a problem.
Captain Mark Niswadomi is the commander at Naval Base San Diego. He says when problems arise, he tries to work with the contractor.
My fellow commanding officers, when their sailors have issues, please bring them up. And nobody should be suffering in silence. Let's hear about them, because we don't know about them. And the sailor may be struggling, and they don't need to feel that way.
The recently passed defense budget would require the Pentagon to negotiate a tenant's bill of rights for military housing. The local commanders will have some discretion to withhold incentive payments. Locally, the captain says Naval Base San Diego doesn't have housing inspectors on staff, but 3 people will be hired in January. Their job will be to check the issues raised by families.
If you're not finding satisfaction or resolution, bring it up to Navy Housing. We have a housing office here on base. And if we reach a hard spot, then I'm going to get brought in and the team that we can start asking, what are we doing with this family?
The contractor has told the Navy that every home in Murphy Canyon will be inspected. For now, though, at least 17 families are expected to remain in hotels over Christmas, with no definite answer on when they will come home. Steve Walsh, KPBS News.
Residents and commuters in Carlsbad and Oceanside have something to celebrate. A plan to ease congestion in those areas is moving forward. KPBS reporter Priya Sridhar explains.
Next fall, construction is expected to begin on new express lanes in each direction on Interstate 5 between Palomar Airport Road in Carlsbad and State Route 78 in Oceanside. The lanes will be open to vehicles with 2 or more people, motorcycles, mass transit buses, and qualified clean air vehicles.
So the idea is for the express lanes to be free flow conditions. So in theory, it should save time for the commuters because there will be an alternate mode of transportation and hopefully people will carpool.
The lanes are scheduled to be complete in 2022 and will give commuters along I-5 access to 20 continuous miles of express lanes in each direction from the 805-5 split to State Route 78. The $100 million project also includes sound walls in Carlsbad that will help reduce noise pollution to residents. The plan also gives people ways to use alternative transportation. Caltrans project manager Arturo Jacobo says they're adding 7 miles of new bicycle lanes near I-5 in Solana Beach.
Meaning it's a bike lane completely dedicated only for bicycles and for pedestrians separated from the freeway.
Caltrans says the disruption to nearby residents will be minimal. They'll only close down through lanes during off-peak traffic times. Priya Sridhar, KPBS News.
Another day on the picket lines for Kaiser Permanente mental health clinicians. Along with San Diego, workers walked the line in 9 other California cities. This was day 3 of a 5-day strike. Psychologists, social workers, therapists, psychiatric nurses, and other healthcare professionals represented by the National Union of Healthcare Workers are demanding better benefits. Similar strikes took place in LA, Riverside, Fresno, and in several Bay Area cities. Go to the Mission Beach Boardwalk, you'll see electric scooters. Go to the Pacific Beach Boardwalk and you'll see them there too. But the San Diego City Council voted this week to ban all motorized devices at city boardwalks. KPBS reporter Matt Hoffman spoke to residents and city officials about the move.
To me, it's an issue of public safety.
Councilmember Barbara Bree supports the scooter ban and has been pushing for one for more than a year.
The boardwalks are classified as Class 1 bike paths, which means no motorized devices should be on them.
A split council voted 5-4 to prohibit the so-called micro-mobility devices along Mission Beach, Pacific Beach, Mission Bay Park, and La Jolla Shores. According to San Diego police, scooter accidents at the boardwalks are rare.
Instead of trying to use regulations and common sense solutions, let's just ban the things. And I mean, if you're going to ban scooters because of accidents, well, then you need to ban bicycles too.
Councilmember Scott Sherman voted against the ban. He wanted to give regulations restricting speed at the boardwalks more of a chance.
And it was 6 months ago that we passed the regulations, and then 6 months later, oh, it doesn't work, even though all the numbers from everybody there showed that the accidents and the ridership on the boardwalk were down. Right. And they went right to a ban because it's a certain group that they want to appease.
Data shows there were 441,000 scooter rides citywide during a 2-week period this July. Overall ridership declined to 277,000 riders during 2 weeks in September. Still, Bree thinks San Diegans, like the city council, agreed that a ban is the right move.
I think the public is very supportive of banning the scooters, all motorized devices, on the beach boardwalks.
People we talked to at the Mission Beach Boardwalk say people riding the scooters are the problem.
I'll take my chances on Mission Boulevard opposed to the chances with the scooters here. Just not, I don't know, they're just not courteous, and honestly, they don't care.
I think the scooters are great in places like North Park or Hillcrest where most people use them for commuting or just quick trips. But here they're used for recreation. The people who are using them aren't using them very seriously. Sometimes they're drinking. Sometimes they have small children in tandem with them.
Sherman thinks scooter companies are caught in a political standoff.
Plus, there's nothing wrong with the scooters. So people using them recklessly, that's the problem. And people do that with cars. We don't ban cars.
But Bree doesn't want to take any chances.
They're fighting for market share, and they're fighting for market share on the backs of the public and on the backs of consumer safety.
Scooter company Bird says it remains committed to micromobility in San Diego. Lime says it will wait to see how the company is impacted by a ban. Matt Hoffman, KPBS News.
Like its name suggests, Kitchens for Good uses food to make a difference. It's a culinary program based on the Teach a Man to Fish proverb, which serves City Heights. Speak City Heights reporter Ebony Monet shows us how people are being helped in and out of the kitchen.
Vegetables are being chopped. The grill is hot. and students are double-checking recipes.
Right, because 16 tablespoons of color.
We're teaching them all of the skills they need to work in a kitchen, from cooking on the line, chopping, sauteing, all of that.
Aviva Paley is the co-founder and senior director of Kitchens for Good. With a background in public health, Paley says the Culinary Apprentice program started as a way to tackle food waste and hunger, and it's evolved to do that and more.
Well, our students come to us with these labels that feel like they're emblazoned on their foreheads in permanent marker. Labels like felon, foster kid, homeless, mentally ill, or addict. And these labels prevent our students from getting a job and restarting their lives. So it's our job to help them remove those labels and replace them with new chosen titles of cook, employed, baker, self-sufficient, and empowered.
Tanisha Paget is about 8 weeks into the 12-week program.
I've been cooking for years now in the house with my family, and it brings people together, just the taste of food.
As a mom herself, Paget says it feels good knowing the food she's cooking will feed children and seniors.
It actually brightens my life, my soul, my heart.
Paley says the program is making a deep impact.
Beyond the give a man a fish, how do we teach a man to fish and look for those empowerment models to really help everyone kind of get a hand up?
Kitchens for Good estimates about 86% of students find and stay employed for up to a year and a half after earning the certification. Ebony Monet, KPBS News.
It's chilly and it's very dry out there, but how long will these conditions continue? Meteorologist Mark Mancuso has our forecast.
Checking on your weather headlines. Dry weather with us the rest of the week. With the dry weather, we'll have some breezy offshore winds Thursday and Friday, keeping us mild. And then it looks like it will start to get into a wet stretch here starting Sunday evening. And that continues through Monday afternoon. For today, we did see a system move into central California, drawing us some subtropical moisture into our area, but just too dry for any significant precipitation here. All the showers up to the north. Look at the futurecast. Stays pretty quiet as this feature moves through during the overnight hours. So for tonight, we'll have mainly clear skies. Temperatures will drop to the low 40s, so it's going to be a cool night. Take a look at temperatures around the area. We'll be dipping down into the 30s. Borrego Springs, Mount Laguna's down into the 20s, and heading up the coast there at Oceanside, we're in the mid-30s. So grab the jackets. Now, as we look at the weather on Thursday, well, the dry weather is still with us, and still pretty cool to start it off. But you should have a lot of sunshine and a nice afternoon. Look at that. Isn't that beautiful? Temperatures rising into the 60s. San Diego's at 66, Escondido's at 67, and Ramona is at 66. Just marvelous. Grab the sunglasses. Well, the sunshine fades over the weekend, and we'll see some wet weather coming in, and it stays unsettled into the beginning of the new week. So we are getting into a wetter pattern here. Looking at the forecast for the coast, well, it looks beautiful with that offshore flow, sunshine and mild. You can see showers increasing Sunday, and it looks pretty wet on Monday. Inland, you can see our temperatures rising into the 70s with plenty of sunshine, just beautiful for the end of the week. Sunday, shower chances go up, and there's your wet weather on Monday. In the mountain region, it will be in the 40s Thursday, but in the 50s Friday and Saturday. Chances for rain here arrive on Monday. And in the deserts, well, it will be in the upper 60s most of the time, and the wet weather with us on Monday. I'm meteorologist Mark Mancuso for KPBS News. Back to you.
When California voters legalized recreational marijuana in 2016, some worried about the impact on teen use and emergency rooms. In today's installment of our week-long series, High Hopes, California's Pot Experiment, KPBS reporter Claire Tregesser examines how these concerns are panning out.
San Diego has long been a favorite spot for tourists who come for its surfing, beaches, and parks. But for the past couple years, tourists have also been coming for something else: legal marijuana. And that has contributed to a bump in emergency room visits, says Dr. Richard Clark, an emergency physician and director of medical toxicology at UC San Diego.
It's much easier for people to get it in general. And so tourists or visitors to California will often come in and want to try it because they can get it here so much easier than they can in their own geographical location. And they won't have the experience that many local users have with it, and may accidentally use too much.
That's particularly true with edible marijuana like gummies or brownies that take longer to have an effect, which leads some people to eat too much. Of course, Clark says it's not just tourists who make this mistake. He sees plenty of locals too.
They'll develop what looks like a bit of an anxiety reaction, and their heart rate will be high, and they will say, I don't feel right. They may be dizzy and in a lot of distress.
State data shows since marijuana was legalized, emergency room visits for cannabis poisoning have gone up by 35% in San Diego County. Across California, visits have gone up by almost 49%. At the same time, Clark and many other doctors don't see this as the health crisis many feared. They aren't seeing a spike in serious pot-related accidents or illnesses. Instead, it's mainly been a lot of people who simply need time for the drug to wear off.
There's not a lot of specific treatment that we need to do for them. And a lot of times if we just watch them in a nice, calm environment, they're better in an hour or two.
However, while the risk of long-lasting effects from a pot overdose might be overstated, the risk of becoming addicted is understated, says Dr. Kai McDonald, the medical director at Lasting Recovery, a San Diego addiction treatment center.
The myth in the world is that there's no such thing as cannabis withdrawal. You can just stop smoking. And there's a lot of reasons that people think that's true, but when you take people who use cannabis daily and lock them in a hotel and ask them how they feel, they have withdrawal symptoms.
The risks are most pronounced among teens. He says not only is cannabis addiction a real condition, but research shows that in states where marijuana is legal, addiction rose 25% among 12 to 17-year-olds. And studies have repeatedly shown marijuana has a negative impact on the development of teenagers' brains.
After recreational marijuana use is legalized, that addiction goes up in a very vulnerable subgroup. That's the best data we have, that cannabis legalization means that there's more out there.
Data from San Diego County show that the percentage of youth treated for marijuana addiction increased by about 5%. But it's important to note that marijuana also accounted for the vast majority of youth addiction before legalization. Among adults who seek county-funded treatment, the numbers are completely different. Marijuana is low on the list of the most popular drug of choice, behind alcohol, heroin, and meth. The adult use numbers show why the public health focus should be on the harder drugs, says Dallin Young, the political director for the Association of Cannabis Professionals. To reduce ER visits, he says the law should allow for places where people can go to safely ingest marijuana, where they can get guidance so they don't take too much.
People aren't scared to call the hospitals if they're feeling, if they're not feeling well. But I do want to highlight the fact that in any of those increased ER visits, there have been 0 fatalities.
And that matches advice from Richard Clark, the ER doctor.
If you're going to try an edible, I think you need to start at a lower dose till you know what your reaction is going to be or till you know how it makes you feel.
And then wait before trying more. But as long as San Diego continues to be a top tourist destination, Dr. Clark expects some people could spend part of their vacation in the ER. And not just because they wiped out on a surfboard. Claire Tregasser, KPBS News.
The Food and Drug Administration has approved the marketing of 2 low-nicotine cigarettes. The agency made the announcement saying the products are the first to be approved for marketing through a new process put in place in 2009. The FDA said while it approved the new cigarettes to be marketed, it does not mean they're safe. According to the agency, traditional cigarettes usually have between 10 and 14 milligrams of nicotine per cigarette. The new products, called Moonlight and Moonlight Menthol, have nicotine content between 0.2 and 0.7 milligrams. The opioid crisis is making national headlines, but meth is a major problem in San Diego County. New reports show meth use and deaths reached record highs last year. KPBS reporter Taryn Mento is asking why it's so difficult to treat the problem. She spoke with a psychiatrist at Family Health Centers of San Diego.
Dr. Sepulveda, thank you for your time. From a clinician's point of view, why are we having trouble addressing this problem, and why is it growing over such a period of time?
So one is easy access. Okay, this is readily available out in the street. The other is it's very cheap to get, so it's not a barrier as far as price. The other reason we're having a hard time getting a handle of this is because we don't have a lot of funding to treat this disorder. So for example, some of the treatments like contingency management that's very effective for treating methamphetamine requires funds in order to provide the behavioral positive reinforcement for having abstinence. No one's willing to pay for that, and it's very difficult to secure funding for it. So implementing these strategies that we know are evidence-based and in the real world is difficult.
You mentioned contingency management. Before we get into that, I want to just talk about what is the standard treatment for meth addiction?
The matrix model is one treatment modality that we have that's evidence-based for methamphetamine use. And what that basically means is it's an intensive type of therapy that we do over several days throughout the week. A patient typically shows up 5 days out of the week. For the majority of the day, they have group therapy, individual therapy, motivational interviewing. We do urine toxicologies, contingency management is a part of that, and 12-step programs are a part of that as well. We have that type of program here at our IOP, which is Intensive Outpatient Program for Substance Use Disorders at North Park Behavioral Health. In addition to that, we do use some medications. We don't have any FDA-approved medications like we do for other substance use disorders, namely opioids and Suboxone and Methadone, which a lot of people are aware of. But there is some evidence for some medications for which we use that show a benefit in reducing meth use.
Why can't we use medications that are approved to treat opioid addiction to treat meth addiction?
It's a good question. The reason is because meth hits different parts of the brain. Opioids hit what we call the mu receptors in the brain. It's one specific receptor, and we can target that with the medication that we're currently using, which is Suboxone and Methadone. In addition to that, we can use naltrexone. But we don't have that specific target for methamphetamines. They hit various parts of the brain, so there's not one specific medication that'll work.
So when we're talking about this intensive therapy treatment for meth addiction, how successful is it?
If patients engage in the structured program and they complete the program, we have very good results showing that they're able to sustain sobriety for an extended period of time thereafter. So it is very, very beneficial for meth addiction.
Now going back, what is contingency management?
Really what it involves is a patient coming in and submitting urine toxicology at least 2 times per week. Each time they submit a urine toxicology, if it is negative for methamphetamines, which is the drug we're testing for, then we provide them a positive reinforcement, a prize, so to speak, right? And every time they submit a subsequent negative urine toxicology, they get more draws toward a prize. And we're basically reinforcing the behavior. What we're doing here at Family Health Centers is we're in the midst of starting a contingency management program.
For people who may be tuning in and say they have someone that they know that is addicted to meth or is a meth user, what are they supposed to do to support that person, either to get them into treatment or throughout treatment? And what should they not do?
Realize that this is a disease that they do not have control over. It is not a moral failing. This is truly a disease that we know very well works in a certain way in your brain. We have evidence for this. So there is treatment available. Just support your loved one. Know that there's help. Help them seek the help that they need. such as coming to a place like family health centers or wherever they offer addiction treatment services. And for the family themselves, this is a big trauma for them as well. So please seek services for yourself as well to support you.
Thank you very much for your time.
Sure. Thank you.
Dr. Google is in the house, and users flooded the search engine with their most burning health questions in 2019. In today's Health Minute, Jeremy Roth shows us the top 5 most asked questions this year.
Here are the top 5 questions asked of Dr. Google in 2019 and our answers based on medical experts' information. Hiccups often start out of nowhere. The U.S. National Library of Medicine notes they often happen when you eat too quickly, drink alcohol, or are feeling nervous or excited. According to the U.S. Centers for Disease Control and Prevention, about 8% of people in the U.S. get the seasonal flu. The duration depends on how bad the virus is. Most people can get by with over-the-counter fever reducers, while some will need an antiviral from their doctor. Just like they can start out of nowhere, they can go away just as randomly. Most of the time, they will stop after a few minutes. However, if they persist, see your doctor. There is no shortage of at-home remedies passed down through the generations. Of course, not all of those will work. It's the top diet-related term for the second year in a row. The diet is high in fats, moderate in protein, and very low in carbs, which forces the body to go into ketosis, breaking down ingested and stored body fat, then using that as energy. This was the #1 medical question people wanted to know about, and no wonder. According to the CDC, 1 in 3 U.S. adults have high blood pressure. Eating a healthy diet with less sodium, watching your weight, and relieving stress can all help reduce blood pressure. For today's Health Minute, I'm Jeremy Roth.
I'm John Yang. Tonight on the NewsHour, history in the making. The full House votes on impeaching President Trump. Coming up at 7, right after Evening Edition on KPBS.
You can find tonight's stories on our website, kpbs.org/evening edition. Thank you for joining us tonight. Have a great evening.